All right, guys, no surgical content today. I'm about to go into surgery in a bit, but one thing that is crazy is that we see a lot in insurance practices, because we do both here, right? We do ophthalmology and we do facial cosmetic and oculoplastic surgery, and a lot of other things in between, is how few places take insurances like Medicaid and how few places have affordable rates for uninsured patients. And one thing that we've been lucky enough to continue over the years, and that I, pretty much got, my dad still practices, but what I learned from him was you never turn a patient away for anything. You help them out, and the financial side will figure itself out. And truthfully, I got my MBA, our practice is growing, and we have other doctors joining us who are doing a great job. But it is not a smart financial decision to take certain insurances. A lot of them don't reimburse well or at all. They don't let you practice medicine the way you want to. And a lot of people don't want to see patients in that category. They usually have had lack of access to care. So by the time you see them, they have more problems that are harder to treat, and you got to see them a lot of times, and the surgery's more complicated, and you got to do all these glaucoma procedures and complex cataracts and retina injections and all this stuff, right? And it's not fun. You have to see a lot of these patients to make it sustainable. So how we make it sustainable, how we can keep our quality of care high for these patients, is one, we have our own facilities, right? So we have our own operating rooms in both our locations. And my dad first started doing that because we were seeing so many uninsured patients. If they needed to get a cataract surgery around here, it was costing somewhere between $11,000 to $25,000 per eye. We get that cost down to barely $3,000 per eye. And they get to use all the same technology that any other insured patient would. And doing a lot of pterygium surgeries and stuff. Now we also do a lot of insurance cases in our office as well. But that has helped us keep costs down. And two, because we do the cosmetic side and all that stuff of our practice, that is something that essentially allows us to continue doing those things without worrying about the finances, So we can see a day of, 20 or 30 Medicaid patients, 40 Medicaid patients, doesn't matter. We're not really worried because the practice gets supported by the cash-based side of it. Some call it a Robin Hood sort of mentality. But that's really what our desire is, to expand access to care, to give the best care possible, to do the most premium services, and help the people who need it.